Welcome, everyone. Thank you for joining us today. We are here to mark the release of the updated COVID-19 Global Humanitarian Response Plan. On March 25th, the first iteration of the plan was launched. The plan is a joint effort by the entire UN system of international organizations and NGOs who have a humanitarian mandate. And the plan's purpose is to analyze and respond to the pandemic's direct public health and indirect, immediate humanitarian consequences, particularly on people in countries facing other crises. Since that date, the plan has been updated. It now covers additional countries, and there is a new expanded funding appeal. To explain more, we have a group of distinguished speakers with us today. The UN's Undersecretary General for Humanitarian Affairs, Mark Lowcock, the Executive Director of WHO Emergencies, Mike Ryan, the President and CEO of Oxfam America, Abby Maxman, the UN High Commissioner for Refugees, Filippo Grandi, and the Executive Director of the World Food Programme, David Beasley. You will hear from our esteemed panel about the different impacts of the pandemic and what we can expect in the coming year. You'll hear also what has been achieved so far through our coordinated humanitarian efforts. For example, the installation of hand washing stations in refugee camps, the distribution of gloves, surgical masks and gowns, and the creation of new transport hubs to keep aid supplies and staff to help reach with AIDS supply and staff the places that are so desperately needed, and so on. You'll also hear about the crucial impact of NGOs, international and local, and how they are now going the last mile to get help on the front lines where it is needed most. A Q&A session will follow. The presentations from our panelists. Journalists accredited to the United Nations have been already invited to submit questions in advance, and I will put these questions to the panel. Ladies and gentlemen, humanitarian workers continue to protect, save, and transform the lives of millions of vulnerable people every day, despite numerous, and you can imagine, ever-growing obstacles. They are meeting the needs of the most vulnerable, including women and girls, people with disabilities, and refugees. This is only possible because of the generous funding that donors have provided, and it will only continue if additional funding is made available. This plan is therefore crucial to ensuring the most effective and vulnerable population groups in priority countries can cope. UN Secretary General Antonio Guterres is unable to join us today, but he has sent the following message. Can we start the video?
6 weeks ago, the global COVID-19 pandemic began to hit some of the world's most fragile countries. I asked governments to step up for the world's ultra-vulnerable people in a spirit of solidarity, compassion, and foresight. The response was prompt and generous. We now have more than half the $2 billion we asked for. The United Nations and our NGO partners are achieving results for those who need it most. Water and soap are being delivered to vulnerable refugees. Hospitals and clinics are getting support. Life-saving information campaigns are reaching millions of people, and the global system of air links is transporting medical supplies and equipment to some 120 countries worldwide. We are ramping up to 700 flights each month for cargo and passengers. My message today is simple. We have made a good start, now we must build on it. We need $6.7 billion to protect millions of people and help stop the virus from circling back around the globe. Humanitarian aid is not just a moral imperative, it is a practical necessity to combat the virus. If COVID-19 wreaks havoc in the poorest places, we are all at risk. I urge your strong, continued support for this appeal. Thank you.
So thank you, Mr. Secretary General. Unfortunately, I think we couldn't see him, but I think everybody heard him and his message loud and clear. So without further ado, I will turn the video over to Undersecretary General for Humanitarian Affairs and the UN Emergency Relief Coordinator, Mark Lowcock.
Thank you, Melissa. Welcome, everyone. COVID-19 has now affected every country and almost every person on the planet. But the most devastating and destabilizing impacts will be felt in the world's poorest countries. They face a double whammy. First, the direct health impact, with the first peak of the disease expected in many of the poorest countries in the next 3 to 6 months. But second, the impact of the global recession and the domestic measures taken to contain the virus. We can see right now incomes plummeting and jobs disappearing, food supplies falling and prices soaring, children missing vaccinations, meals, and school. We must be prepared for a rise in conflict, hunger, poverty, and disease as economies contract, export earnings, remittances, and tourism disappears, and health systems are put under huge strain. Lockdowns and economic recession may mean a hunger pandemic ahead for millions. In many places, the impact of national measures to contain the spread of the virus and the global recession may be larger than the direct impact of the disease. We must fight the disease, but in the poorest countries, it won't be the only battle we face. A coronavirus vaccine is essential, but it will not save a child starving to death. If we do not act swiftly, we face a reversal of the development gains we've made over several decades. Based on our analysis, the cost of protecting the most vulnerable 10% of people in the world from the worst impacts is about $90 billion. That might sound like a lot, but it's equivalent to just 1% of the global stimulus package the world's richest countries have put in place to save the global economy. To meet these costs, wealthy countries will need to make a significant one-time increase in their foreign aid commitments, and international financial institutions will need to change lending agreements with vulnerable countries. The alternative is dealing with the spillover effects for many years to come. That would prove even more painful and much more expensive for everyone. So this can't be business as usual. Extraordinary measures are needed, reflecting the extraordinary problem we face. The humanitarian system is collaborating in a concerted effort to respond to the humanitarian impacts of the virus on the world's poorest and most vulnerable people. On 25 March, we published the COVID-19 Global Humanitarian Response Plan. It's the international community's primary fundraising vehicle to fight the virus in the most vulnerable low and middle income countries. It brings together appeals from across the UN system. Non-governmental organizations and NGO consortiums are key partners in delivering it. They have been instrumental in helping shape the plan, and they will be funded through it. Humanitarian needs continue to rise. Today's updated plan has been costed at $6.7 billion for the remainder of 2020. It includes 9 more vulnerable countries beyond the 54 covered in the 25 March version, and more countries still are on a watch list for possible future inclusion. Today's update includes a lot more programs to tackle the growth in food insecurity. It outlines measures to address the needs of the most vulnerable, including women and girls, children, older people, and people living with disabilities. Since the first version, we've stepped up our efforts to prevent and address gender-based violence, sexual exploitation and abuse, and to offer support for mental health. And despite operational challenges, our UN and NGO partners on the ground are ready to fully implement this updated plan. Donors have been fast and generous in their response, providing more than $1 billion so far. That generosity has already helped us achieve results, but it's clear that much more is needed. Some people may be skeptical that additional resources can be generated in the current circumstances. That is not our experience. After the financial crisis of 2008-9, fundraising for UN-coordinated humanitarian appeals increased by more than 40% by 2010. That was a result of human generosity and empathy. but it was also a calculation of national interest in the donor countries. So I urge donors to act with both empathy and in their own self-interest today. As the Secretary General has said, this pandemic threatens the whole of humanity. The whole of humanity must respond. Thank you.
Thank you very much, Mark, for that powerful message. And with no further ado, I'd like to invite the Executive Director of WHO's Emergencies Program, Dr. Mike Ryan, to complement Mark's words from the WHO perspective.
Thank you, Melissa, and thank you, Mark, Abby, Felipe, and Filippo, and David for your partnership, and to so many of the UN agencies and INGOs and others who are working so hard in the face of this pandemic. We now have more than 3.5 million confirmed cases of COVID-19 and over 250,000 deaths. A very sad milestone has been reached. We do see some encouraging signs with decreasing cases in Europe and elsewhere, but in South Asia, in Africa, the Caribbean and some parts of South America, the numbers are still rising. In countries facing humanitarian emergencies, the impact of COVID-19 could be devastating in terms of health. What is certain, though, is that the so-called lockdowns are having an impact right now on lives and livelihoods. Tackling the pandemic while continuing to provide life-saving and essential health services in places where infrastructure is at best limited and often destroyed. Health systems are already at breaking point, and where healthcare workers and communities may be facing conflict and other emergencies, this is an extremely challenging task. It is critical that we maintain these services, from vaccination, water, sanitation, to mental health, and as Mark has said, gender-based violence and sexual and reproductive health. If we don't, we risk people dying not only as a direct consequence of COVID-19, but also indirectly, as they are unable to access essential health services. With regard to mental health, evidence from conflict indicates that 1 in 5 people already has a mental health condition, and the pandemic is likely to exacerbate their conditions and induce risk factors for developing new conditions. It will also limit access of those with pre-existing conditions to the already scarce mental health services they had. Under the Global Humanitarian Response Plan, WHO will support the integration of mental health and psychosocial components as part of essential health packages for all affected populations. Another critical need is access to diagnostics, personal protective equipment, and other essential medical supplies. I would particularly like to thank David, our colleagues at WFP, at UNICEF, at OCHA, at UNDP, at UNHCR, UNFPA, as well as the Global Fund, the World Bank, and other partners for the unprecedented effort to identify, procure, and distribute large amounts of personal protective equipment and other essential medical for frontline workers. Since the beginning of the pandemic, we have shipped testing kits and medical supplies to over 125 countries, especially in Africa, the Middle East, including Afghanistan, Iran, Iraq, Pakistan, South Sudan, Syria, Yemen, and many other countries. We need to protect health workers and other frontline workers, as well as health resources, not only from disease, but from attacks. We're working with ICRC to monitor attacks, and we call on all actors to stop them. Without frontline workers, there is no response. Lastly, WHO and partners have launched a first-of-its-kind initiative called the Access to COVID Tools, or ACT Accelerator, to accelerate the development of vaccines, therapeutics and tools to fight the disease and ensure equitable access to all, especially the most vulnerable. Earlier this week, the European Union hosted a pledging event to support this initiative, with more than 40 heads of state and government took part, pledging 7.4 billion euros. We have also created at WHO a coordination hub to bring together all of the different operational and technical agencies to work together on ensuring that we can deliver on our promises to the people of the world. We thank donors for their commitment and encourage them to be equally generous in supporting the Global Humanitarian Response Plan, helping the most vulnerable and to confront COVID-19 is not only, as Mark has said, it's not just a moral imperative, it is an enlightened self-interest. It is not only the right thing to do, it is the smart thing to do. We won't be safe anywhere on this planet until all people are safe. Thank you.
Thank you very much, Dr. Ryan. And now over to the President and the CEO of Oxfam America, Abby Maxman.
Thank you for having me here today to speak on behalf of my NGO colleagues as proud partners in this global humanitarian response. And a special thanks to my colleagues on the IASC principles for the leadership and commitment to coordination, communication, and community engagement. This launch is an important step in a long-term effort. NGOs at the international, national, and most of all local level are on the front lines every day. I just heard from Oxfam staff in Bangladesh. When asked if they were scared to continue our response in Cox's Bazar, they said, "They are now my relatives. I care about them. And this is the time they need us most." As we talk about global figures and strategies, we must remember we're talking about parents who must decide whether they should stay home and practice social distancing or go out to work and buy food so their children won't go hungry. Women who constitute 70% of the workers in the health and social sector globally, people with disabilities and their carers, and those who are already far from home or caught in conflict. People who don't know what information to believe and follow as rumors swirl. COVID-19 is adding new and exacerbating existing threats like conflict, displacement, gender-based violence, climate change, and hunger. And too many are being forced to weather the crisis without the basics like clean water, soap, healthcare, and shelter. We know too well that when crisis hits, women, gender diverse persons, people with disabilities, the elderly, the poor, and the displaced suffer the worst impacts. These communities need to be at the center of our response, addressing their needs, concerns, and solutions. COVID-19 can't be used as an excuse to stop those in greatest need from accessing humanitarian aid. Border closures, quarantines, and travel restrictions put significant strains on our collective efforts. Authorities should take precautions to keep communities safe, but we must all work at all levels to ensure life-saving aid can still get through and people's human rights are upheld. Humanitarian NGOs and partners are adapting our approaches to continue vital humanitarian support while fulfilling our obligation to do no harm and ensure safe programming. This adaptive approach will be crucial as COVID-19 restrictions increases risks of exploitation, abuse, and protection. To mount an effective response, we must strengthen and adapt existing funding mechanisms to allow our system to address the scale and complexity of humanitarian needs. NGOs urgently need funding that is flexible, adaptive, and aligned with grand bargain commitments. Our work is well underway, but much more is needed to get resources to the front lines. We need to better resource country-based pooled funds, which are crucial for national and local NGOs. Now more than ever, donors must support flexible mechanisms to significantly increase funding flows to NGO partners. In closing, the international community must continue the battle to this pandemic in an inclusive and responsive way that puts communities at the heart of solutions. As we implement this plan, it will be crucial to take the lead from local and national NGOs, women's rights, and refugee-led organizations. We must address this threat now, maintaining a holistic response. This means continuing response to the looming hunger crisis, maintaining access to humanitarian aid, and supporting existing services, including sexual and reproductive health and gender-based violence services. Funding must be quickly mobilized to reach NGOs and be flexible between needs and countries. We all know the virus can affect anyone, but it disproportionately affects the marginalized. It's our collective responsibility to ensure that our global response includes everyone. We owe it to those I mentioned in Cox's Bazar and all those like them around the globe to get this right. Thank you.
Thank you very much, Abby. Much appreciated, and much appreciated all that your organization is doing for humanity. I now give the floor to the UN High Commissioner for Refugees, Filippo Grandi.
Thank you very much, Melissa, and thank you all. It is clear already from what we have heard. This is not only a refugee emergency. It is a much bigger crisis, but a crisis in which refugees, displaced people, migrants in particularly vulnerable situations are among the most exposed people in the world. Think of crowded camps, some have already been mentioned, in Bangladesh, for example, Dadaab in Kenya, or camps on the Greek islands. Think also, however, of overcrowded urban situation in poor outskirts of cities in South America, in Africa again, where many refugees and migrants congregate. This is why in this appeal amounting to $6.7 billion that Mark has spoken about, 1.5 billion is devoted to situations to large refugee situations or situation of mixed flows of refugees and migrants. What have we done so far? We've been working hard with states to ensure that refugees and migrants are included in health responses in particular. And we have added support whenever needed in all the areas that have been mentioned. Basic health care, health supplies, health infrastructures, clean water supply, increase it wherever possible, better hygiene measures, and very important, information campaigns to communities like refugees that are often in very isolated places. To do this, it has been invaluable to take advantage of contributions, especially unearmarked contributions, but also all contributions that have come in after the first appeal was made. And let me stress again what others have said. What has been invaluable as well has been the role of civil society, of local NGOs, of international NGOs. Just to give you a sense, in general, how much we rely on NGOs. UNHCR's 1/3 of UNHCR's expense last year, $1.2 billion, was channeled through NGOs. So this is a very important aspect of our work. There has been no major outbreak of COVID in these situations, but as we race against time to step up health and other measures, another emergency is creeping in and is already happening. An emergency of livelihoods. Refugees, displaced people, migrants depend on fragile incomes, which are the first ones to disappear in situations of lockdown. Poverty strikes often before COVID-19. Look at what's happening to Venezuelans in South America, to Afghans in Southwest Asia, to Syrians in Lebanon, Jordan, and other countries. And look at what is happening also to many communities hosting these refugees that require the same attention. This, of course, has a lot of ramifications. Mike spoke about mental health. Many spoke about women and girls, particularly affected. We have observed already an increase in sexual and gender-based violence. We have certainly seen an increase in exploitation, early marriage, prostitution as coping mechanisms collapse, and this requires the utmost attention. We really continue and must continue to be very mindful of the risk of discrimination of these groups, very high in situations of pandemic. We've seen it many times in many occasions during Ebola. And of course, we also have to be vigilant that refugee protection systems that are often suspended during pandemic are temporarily so, and that they can start again once the pandemic is over. Last but not least, I would like to say that the collapse of coping mechanisms carries another big risk, which is the increase in human trafficking. Many of the countries in which hardships are generated by COVID-19 are countries on fragile and dangerous migration routes. And we know what these movements are caused by conflict and poverty, often in combination. COVID-19 adds to these hardships and adds motivation, adds space for further population movements that we need to remain vigilant about. So the whole livelihoods emergency needs immediate attention through cash transfers. They constitute a big part of this appeal, but also through appropriate link between humanitarian actors and development actors. It has already been mentioned, but also, if I may say, and in conclusion, it needs attention on the political and security side by heeding the Secretary General's call for a global ceasefire. Thank you.
Thank you very much, Filippo. And it shows how this COVID-19 is compounding the already existing problems that you are facing and that the world is facing. Our last speaker, who I'm sure will add to that, is the Executive Director of the World Food Program, David Beasley. Over to you, David.
Melissa, thank you. And it's good to be with all of you. And Mark, it's great to hear from Mark, throwing out the numbers and the reality that we're facing. Abby, Mike, Filippo, thank you, all of you. And can everybody hear me? Melissa, can y'all hear me good? Okay, great. So everybody said pretty much the numbers and gave a pretty good, I say a pretty good, actually it's a pretty grim picture of the reality we're facing. So when I spoke to the United Nations Security Council a couple of weeks ago, I think I probably shook things up, but I think people at that time around the world were looking only on the immediate impact of the COVID health disaster that we're facing. Now people are beginning to realize that the decisions that we make on supply chain have a grave impact around the world. And so what we're facing now is a double pandemic of truly famines that could impact us in biblical proportions. There's no question mega famines are on our brink, literally right now. Before COVID hit the scene, I mean, we already had 135 million people, as I say, marching on the brink of starvation. That's in addition to the 821 million people that are chronically hungry. We're talking about people who don't receive emergency support will die. We reach about at World Food Program about 100 million of those people. 30 million of those receive only food from us. So you can imagine what happens if the economic deterioration continues, and if the supply chain breaks down, it will be catastrophic. We are the only things right now that's keeping famine in many, many, many countries. And when you go back to World War II, we've been, I said about 3 months ago that I thought that the year 2020 would be the worst humanitarian crisis year since World War II. Well, in some ways, let me explain, you didn't have a breakdown of supply chain globally during World War II, only in the conflicted areas. We've got a breakdown of supply chain globally right now if we don't thread the needle and do what's necessary to assure that we don't have export-import bans, restrictions at borders, shut down of ports, shut down of distribution points. We already have some countries that are putting on export bans, the ripple effects taking place. If young people, and Mike was talking about this, you take a young person who may be 23, 25 years old, working in the urban area in Africa, and they lose their job, they don't have a bank account to draw upon for weeks. And if they don't have food, you're going to have protests, riots, unrest, destabilization. It's going to cost the world 100-fold more to react after the fact, as opposed, as Mark was saying, the monies that we need now is really a small amount compared to the whole and what it will cost us if we don't do what's right. And so the World Food Program working with our partners, we have got truly some amazing people that can drive solutions in countries. One of the things that we're working together so well on is the appeal for the $965 million that we will need for humanitarian logistics services. And so that we can make certain that the medical supplies, but also personnel, because the airline industry is pretty much shut down. And so you take Africa, where passenger airlines were carrying people, but underneath they were carrying cargo, medical supplies, whatever the needs were. That's shut down. So we're picking up that tab now. That's an expensive proposition. Over the next 9 months, we anticipate that to be about $600 million alone, just on the transportation services. But we're going to be providing ambulance services, hospitals, setting up distribution points around the world as we're doing. And I think with WHO, UNICEF, Filippo, UNHCR, I think we've already made distributions in over 130 countries so far. Millions upon millions, testing kits, PPE, gloves, ventilators, gowns, the things that you need in a COVID type response. And people ask, well, is the UN prepared to handle this type of emergency? I'm like, yes, we've handled war and conflict, we've handled Ebola, and we can handle COVID as well. But we need money and we need a supply chain to continue, because we're seeing tremendous economic downturns. We're looking at about 1.6 billion people losing their jobs. People don't realize the impact. If someone living in the United States who's providing remittances to their family and friends in Ethiopia or Nigeria, we're looking at $500 billion worth of loss of remittances into poor, vulnerable countries. And I could just keep going on and on. We've got to act. And we've got to act swiftly, and as Mike said, smartly, and we have no time to waste. And so, Melissa, Mark, thank y'all for bringing us all together. I do believe the world, when the world hears the truth, the reality that we're facing, I believe that taxpayers around the world will rise to the occasion. And so I'm asking the media here today, please, I'm begging you, help us get this message out. I know the people in America are worried about America. I know the people in Germany are worried about Germany. But I also know if they hear the truth about the reality that we're facing, their hearts will be touched. They will reach into their pockets and they will help us bring stability and peace around the world. Because if we don't, the price is going to be absolutely catastrophic. We're facing famines of biblical proportion. We can avert famine if we act, and we act now. So, Melissa, I'll turn it back over to you. Thank you for letting me make some comments.
Thank you very much, David. And that is a very good transition to our journalist questions. The first one is from Edith Lederer from the Associated Press, whom you all know. Her question is, the $2 billion appeal launched 7 weeks ago has raised $1 billion. Who is going to pledge the billions more needed, and how long will it take? And since I think, David, you just addressed that, but perhaps you would like to start and maybe add to what you were just, beyond your hope that people's hearts and pocketbooks will open up, and governments as well. What are your expectations for funding following this appeal? And then I'll hand the floor to Mark after you.
Well, Melissa, I'm in Washington, D.C. as we speak. I met with an hour yesterday with Secretary of State Pompeo. I was on the phone with many other leaders in D.C., talking with Senator Lindsey Graham for literally 30, 45 minutes, met with several senators. And I say that because the United States, Germany, our major donors, I have not heard one of them yet say, we can't help. We've got our own problems. But they're saying, well, yes, we've got to take care of our own home. But let me give you an example. Yesterday, I had several of the senators saying, what else do you need? What can we do? And we've got to make the case to them so they can tell their taxpayers it's worthy of sending money abroad in these difficult times. And here's why. Germany, when I was talking to Germany just the other day, they're like, what do you need? Here's what we want to do. Let us, I mean, Germany just stepped up with like 45 million for the humanitarian services, just like that. I called Mohammed bin Zayed and I said, I need a 747, a 737, a C-130, and a hospital in Abu Dhabi. He said, you got it. Well, that's big, but the media has got to help us get this message out, because we're just now, I think, tapping into the real money. It's going to take serious money, and we've got to get the message out. We got to keep beating the drums, doing all these virtual phone calls that we're doing now that really are making an impact. And I think with Mark Lowcock and Mike Ryan and Filippo and Abby and Henrietta Fore, if we keep singing the song, giving the truth, because I don't think people realize how consequential the decisions that are being made on economic lockdowns and supply chains, how dramatic those impacts are having on developing nations. So leaders have got to thread that needle, because it's not just money, it's also supply chain, and it's how we respond with restrictions and border controls and these types of decisions. So, Melissa, I'm hopeful, but the consequences will be severe if we don't get the money we need.
Thank you, David. And I wonder if Mark would like to add to that to address Edie's question.
Well, I think what David just said, Melissa, is very important. The world always deals best with the biggest problems when there's a strong lead from the United States. And the US is the most generous financier of humanitarian action still. And so the conversations David is having right now, I think, are very, very important. So far, in terms of the $1 billion that we've raised, a lot of it has come from Europe, Germany, the UK, the European Commission, many other European nations. But we've also had important contributions from Japan, Gulf countries, Canada, and a whole range of others. And I think our message is, this is a common global problem. There needs to be a common global response. So everybody will need to step up.
Thank you, Mark. I think that probably you're speaking for everyone there. Our next question goes to each of the panelists, and I'll just ask if when you reply to this next question, those of you who didn't respond, Filippo, Abby, to this one, if you had anything you wanted to add about your expectations for funding. This question is from Pamela Falk from CBS News. She says that the report says coronavirus infections to peak in the world's poorest countries in the next 3 to 6 months. What regions are the panelists most concerned about? And is the virus spreading in refugee camps? And since, Mark, you're still on the screen, maybe you can start and then Filippo could follow.
Well, I think that Mike is a very good person to comment on in more detail on how we see this playing out. But we basically see it playing out in most regions, and we're most worried about the places which have already got the biggest challenges. Clearly, as Filippo was saying earlier, the virus loves places where people are very congested, where they're tightly mixed with each other, and displaced people and refugees tend to be very tightly grouped together, as do people in urban settings and slums. So we have to be particularly worried about those people and plan for novel and innovative ways on how we can best protect them. Thank you.
Okay, Filippo, and then Mike.
Yes, like I said earlier, we have not seen major outbreaks in specific refugee camps, but we have had also the advantage of intervening early. And as we know, the pandemic has moved first in the global north and is maybe now moving in the global south. And most of the camps, of the 70 million displaced and refugees, let's not forget that 85% live in countries in what we call the global south, in poor countries, middle-income countries. They have been hit by the pandemic, but so far, mercifully less. This has given us a bit more time to prepare. But certainly they remain places of extraordinary vulnerability. And it's not just the refugee camps. It's also, like I said, the outskirts of big cities where you have huge populations, sometimes multiplied by the presence of refugees and migrants. Think of the big metropolis of South America, for example, or big cities in Africa or in South Asia. So these are extremely vulnerable situations, and I think it is important that we continue to focus on prevention collectively and preparedness measures. The important thing is that these situations are included in national responses, but we need to add additional resources because many times states can hardly cater for their own population. Imagine when they have the population increased exponentially by these large population movements. I want to add, if I may, Melissa, 1 second, on the broader question that you addressed earlier to the first speakers. You know, I think, and what David said is so important about the importance of thinking that, yes, we are all hit by this emergency, but we all share the challenge. And somehow, you know, there is a humanitarian imperative, but there is also some self-interest. If we leave epicenters of the pandemics unattended, even in a refugee camp remote from us, it may come back to hit everybody else. This pandemic shows that these challenges do not have borders. This is why I am happy so far of the humanitarian response. By the way, we haven't mentioned this, but of the response of the sector of the appeal that my organization, UNHCR, has managed, 10, 15, maybe more than 15% was contributed by individuals and by businesses, by the private sector. And this is a very important testimony of how this solidarity is felt globally. Thank you.
Well, that's very good to hear. Thank you, Filippo. Mike, would you like to add anything on what you and WHO are most concerned about in terms of where this spread is going to next hit?
Hi, I think it's difficult to predict, as we've seen. Many predictions in this pandemic have not come true. But I think what can be absolutely certain is we need to worry very much about countries in Africa, in the Middle East, in South Asia, and in certain parts of Central and South America. And the reasons driving that are different. We need to recognize, and I think Filippo said it very well, in some countries there are very large urban poor populations in which this disease could spread extremely quickly in the context of weak health services. In other countries, many people are living in disputed areas, in areas of conflict where they have no immediate access to care or aid. In other areas, we see small island states where, you know, they may not have disease now, but one case or two cases can be the difference to create and generate a devastating epidemic. We've seen that. You've seen measles in the Western Pacific just before COVID. Just before COVID, we had the horror to watch every single ventilator in Western Samoa occupied by a child with measles. So we can see what an epidemic disease can do in an indigenous population historically, in an island population, in a refugee population. Those of us who've worked for years and seen cholera rip through refugee camps. I think it's a great testament to the work of Felipe, the UNHCR, the IOM, the Red Cross movement and the NGO movement, who I think have provided, with governments, a huge degree of shielding for people living in camps, have done a lot of preparatory work, and it's to their eternal credit. But that thin blue line, that won't, it isn't perfect. And therefore we have to get rid of the disease, and we have to suppress the disease in general in order to protect and cocoon, to the extent possible, those highly vulnerable people. Much like in the north, we're seeing the phenomenon of long-term care facilities. Any situation in which people are pushed together in a context where they cannot maintain physical distance, where they have underlying vulnerabilities, and where they do not have access to adequate personal hygiene, safe water, sanitation, and the most basic of decent access to food and welfare, that is the tinder in which this epidemic may explode.
Thank you, Mike. And Abby, would you like to add anything?
I would. Thanks, Melissa. adding to what everyone has said, it's not a particular place right now. We know that 60% of refugees do not live in refugee camps. So they are in crowded urban slums. They are in host communities. And so the real urgency is about speed and scale, about getting resources to the front lines, to local organizations, refugee-led organizations, women-led organizations who are the first responders, and using the NGO and international systems to get the resources to the front lines, to get the prevention and preparedness going, not diverting the other humanitarian aid that's essential to keep people's lives and livelihoods in place and intact while the response, preparedness and response happens. So it's really essential right now. Speed, scale, get resources out. We have to move things quickly now. Thanks.
Thank you very much, Abby. I have another question from Betul Yurik from the Anadolu News Agency, and I think this might be directed to David Beasley. There are now 9 additional countries to be included in the aid programs to respond to food insecurity. Is there a concern about food insecurity for those countries, and how many countries in total are there which are getting some sort of UN support aid to tackle the coronavirus outbreak? I think the second part of that question might go to Mark. How many countries are in total are there getting some sort of UN support aid to specifically tackle the coronavirus outbreak? But the first part, if David could address this on the 9 additional countries, and is there concern about food insecurity in those 9 additional countries?
Yeah, Melissa, let me add there, and we're breaking down countries as we speak. This is unfolding as we are literally are in motion on this, but we already are in 80 some odd countries, and so we're already providing supplies and materials, COVID, in over 130 countries as we speak. But we're breaking down now as to sort of the first question and this question was, and I think Mike hit upon this. Each country is unique, and I asked the media to please work with us to, yes, look at the big picture, but also to look at each individual country, because every country is different. For example, Ethiopia, 50% of their export revenue is tourism. Well, that's dead. 98.8% of South Sudan's export revenue is oil. Well, that's collapsed. Nigeria, 90%. Syria depended upon Lebanon. The Lebanese economy has collapsed. The banking system has collapsed. The Syrian people that had money into the banks in Lebanon can't get that money anymore. They have no coping capacity. 2 million more people are now food insecure in Syria than there were just months ago. So each country has to be broken down, because decisions that we make, particularly in developed nations, have a rippling effect differently upon every other country, and particularly in Africa. When you have export bans, you can imagine we've got already now the countries like Russia has an export ban on wheat, rice export ban from Myanmar, Vietnam, Cambodia, Thailand, I believe. And this is just the beginning. The ripple effect that has on vulnerable countries being able to get supplies, which begins spiking up prices, which makes it harder for people who already don't have the capacity. Here's one of the things that when you deal with the quantity of the problems that we've been dealing with year after year after year, we go to the donor nations for money on an ongoing basis. This is one time, I think Mark was sort of hitting on this. This is a one-time phenomena, a catastrophe we're hitting that's so unusual. It's not unreasonable now for our wealthiest people in the world and wealthiest companies in the world to step up in a major, major way. Because if they do, we'll all benefit. If they don't, everyone is going to pay a price. So I would like to see some of the wealthiest people in the world who are making money right now to step up, be generous, pull out your pocket, and generous with your heart. I don't mean just a few million. I'm talking about hundreds of millions of dollars, billions that we could really need right now from individuals around the world who have the wherewithal to do that. This is the whole world at stake right here, and we all must step up and be willing to sacrifice for those vulnerable people now.
Okay, thank you very much, David. And I think I have a couple of questions for Mark that I'll kind of group together because they're all they're all financial. This is from Ibtisam Azim from the Al Arabi Al Jadid newspaper. He is saying that the report states that according to the UN, the cost of protecting the most vulnerable 10% of people in the world from the worst impacts is approximately $90 billion, and that it calculates that 2/3 of those costs could be met by the World Bank and the IMF if they are supported to change the terms on which they help the most vulnerable countries. And his question is, what kind of reactions do you have, Mark, on getting from states, and how should the terms of the World Bank and IMF change? Can you give examples? And his second part of the question is, any update on the $900 million urgently needed in Yemen to get the UN aid programs going for the coming months?
Well, thank you very much. So firstly, on the 90 billion, which speaks to all the issues David was just explaining. And yes, we think 2/3 of it can come from the international financial institutions because their balance sheets are much stronger now than they were in 2008. They've all been recapitalized. They've had new resources put at their disposal. But what they need is support to change the terms of providing resources to the poorest countries. Right? Business as usual approach is not going to work. Exceptional measures are needed. The institutions themselves, I think, will need to advocate for that, but their shareholders and supporters will need to step up to the plate as well. On Yemen, we had very good news just a day or so ago when Secretary of State Pompeo announced a new contribution, I think of $225 million for the World Food Program that David runs in Yemen. We need others to step up as well. And the Kingdom of Saudi Arabia made an announcement of $500 million a month or so ago. It's really, really important that these announcements are turned straight away into cash. And we need the same from other countries. Every month, the UN is trying to feed 13 million people in Yemen. We're trying to get health services to millions of people. We're trying to provide shelter and protection to millions of people. They will only survive if we can keep doing that. We need to battle against the restrictions put in place by some of the parties in Yemen, which are not acceptable, but we need to keep the resources flowing as well.
And while I have you, Mark, thank you. Philippe Ratter from AFP is asking another question on finances. He says the appeal of $2 billion in March was for the expenses until the end of the year, and that you changed that amount today. And does that mean that we can expect new appeals again in the coming?
This is a very fast-moving situation. And the smart thing to do is to learn as we go along and update our responses as we go along. So yes, I expect that before the end of June, we will need to update our responses, and we'll need to think about whether there are additional needs. And we're going to have to keep doing that as the situation keeps evolving.
Thank you, Mark. And there's another specific question to you. There are only 2 more questions. And so this is the second to last question from Genshi Yamaguchi from Kyoto News. It's about DPRK. Can you tell us how to ensure the amount of $39.7 million to DPRK to support vulnerable people, not to help directly or indirectly the regime to develop its nuclear weapon and ballistic missile program?
The UN, through our team, including colleagues from the World Food Program and UNICEF and others, are very experienced in making sure in North Korea that help gets to the people who need it. And we will continue to make sure we do that. Nutritional support, urgently needed medical supplies to deal, for example, with tuberculosis. Most of the things we're doing only have one use. There's only one thing you can do with an an anti-TB drug, which is to give it to somebody who has TB. So there's lots of protection to make sure that resources countries give us are used to the right purpose.
Very good. And then there's a final question from Ibis Frade from Prensa Latina. The Secretary General has asked to put an end to the unilateral sanctions during the pandemic, while Cuban health personnel help other nations in the fight against COVID-19. The blockade of the United States to Cuba prevents the arrival of aid and medications. What is the position of the UN agencies and what actions can be taken in this regard? Do you have any comment on that?
Well, firstly, one of the things we're calling for is all nations to collaborate, support each other in tackling the pandemic. So we think it's very good that Cubans are involved in the medical response in lots of other countries, just as the nationals from 150 other countries are helping elsewhere as well. This is part of global solidarity and collaboration. Yes, the UN believes that what's needed now on sanctions and comparable measures is to make sure that none of them have the unintended consequence of hindering or making it more difficult to win the fight against COVID. So we hope that all nations will review the measures they've put in place and make sure that that is not the consequence of those measures.
Thank you very much, Mark. Thank you very much, panelists. And thank you very much, friends of the media, for tuning in. And also thank you for your excellent coverage and the coverage that we can expect today. As I think David appealed to you, we need the media more than ever to inform the world about the state of the world now, but also what is to come beyond their own borders. So thank you again. This is obviously not business as usual, extraordinary times. Thank you, and stay safe and stay well, everybody. Goodbye.